Hey guys, so I did mental health and aging. Okay, so mental health and aging in America. So in the US, including older adults with dementia, 20% of people older than the age of 55 experience mental health disorders that are no part of normal aging. The most prevalent mental health problems in late life are anxiety, severe cognitive impairment, and mood disorders. Other severe cognitive impairments include dementia, Alzheimer's disease. Mood disorders include, but are not limited to, are bipolar disease and depression. So according to Maryland Coalition on Mental Health and Aging, only about 10% of older adults get treatment for mental health. According to the World Health Organization, or WHO, the most common mental and neurological disorders are dementia and depression, which affects approximately 5 to 7% respectively of the older adult population. According to Maryland Coalition on Mental Health and Aging, older adults have the highest rate of suicide of any population, with white males over the age of 80 are 6 times more likely to commit suicide than any other group. So changes in body system. According to the Maryland Coalition on Mental Health and Aging, mental health is physical health. So what happens? What changes? There is a decrease in the number and mass of nerve cells, which result in slight slowing of memory and thought process. And there's also a reduction of reflexes. There will be changes in sensory deficits, for example, the hearing and vision, like those mentioned, contribute to social withdrawal, isolation, paranoia, anxiety, and depression. With hormonal changes, you'll have, they'll also be affecting your mood, energy levels, and behavior. We'll also have changes in appearance or dress, some confusion, disorientation, problems with concentration or decision making. There will also be a decrease or an increase in appetite or weight change. There'll be social withdrawal, loss of interest in things that used to be enjoyable, and memory loss, especially recent or short-term memory problems. So assessment. So mental health assessments can be done by a primary care doctor, psychiatrist, psychologist, or by a social worker. The mental status exam should include an assessment of a client's appearance, motor movements, speech, affect and mood, thought content and thought process, and perception. So with appearance, you have demographics, hygiene, features. Is there an evidence of bruises, scrapes, scratches, or any other noticeable pain response? For motor movements, are movements overly slow, rapid, agitated, or balanced? Speech, what is the rate, volume, tone of the person's speech? Affect and mood, does the person seem sad, agitated? Thought content, does a person have suicidal ideation? If so, what is the level of risk? Is there a plan? Has there been previous attempts? For thought process, does a person's thought process appear to be coherent, logical, goal-directed? Does a person show evidence of impaired memory? And does the person show evidence of hallucination or responding to any internal stimuli, such as images that are not visible by others or voices only they can hear? Some more things for assessment that you can look for is medical information, psychiatric history, functional status, psychosocial history, and spirituality. So with medical information, that includes the onset, the course and duration and severity of the present problem, history of past and present medical conditions, medication usage, if any, and pain assessment. Psychiatric history includes mental status exams, screening for presence of mood, psychiatric or anxiety symptoms, past treatment, family history, any suicidal assessment, and use of alcohol and other drugs. With a functional status, that includes one's current living situation, their ability to care for themselves, and risk assessment. The psychosocial history includes family status, history or family history, friends and social support network, occupational, military, and any educational history. With spirituality, that includes faith life, coping skills, activities and hobbies, and things in life that give a person meaning. So I decided to do my patho over depression just because mental health it's just like a huge umbrella where there's so many things under that it's kind of hard for just to pinpoint that this one thing is a reason for all of these things. So for patho, depression, I chose depression. So depression is a chronic mental disorder that causes changes in mood, thoughts, behavior, and physical health. It's common but serious that can take away a person's ability to enjoy life and cause decline in capacity to undertake even the simplest daily tasks. So I wrote down things that can lead to depression. So we'll have environmental, immunologic, which includes the hypothalamic pituitary adrenal axis, neurogenic, and genetic. So environmental depression results from the environment you're situated in. It can also be caused by bad or traumatic experiences rather than a chemical balance in the brain. For immunologic, the concept of depression as a dysfunction of the immune system. So chronic stress by initiating changes in the hypothalamic pituitary adrenal axis in the immune system, it acts as a trigger for anxiety and depression. According to Keller and his colleagues, their studies show that the HPA axis has overactivity in depression, which is related to cognitive performance. The HPA axis is responsible for the neuroendocrine adaptation component of the stress response. We have neurogenic, which hypothesis suggests that depression is associated with a reduction in the birth of new neurons in the hippocampus, an area of the brain important to stress regulation, cognition, and mood. According to this hypothesis, when someone takes antidepressants, the drugs do raise levels of monoamines like serotonin, but they also enact long-term processes that increase neurogenesis in the hippocampus. And last, genetic. So a family history of depression may increase the risk. It's thought that depression is a complex trait, meaning that there are probably many different genes that each exert small effects rather than a single gene that contributes to a disease risk. Okay, so here I took a screenshot of the geriatric depression scale short form. There is a long form that has about 30 questions, but this one seems simpler and easier. So the short form includes what seems to be the top questions that indicates depression in older adults. So if you guys do decide to take this short quiz, I guess, you can go ahead and pause the video or the PowerPoint, but those who don't want to, you can obviously just skip this. So for those who did decide to take it, I hope you guys paused it because I'm about to give you the scores or kind of like the answers. So if you were to take this, the answers in bold indicate depression, and you would score 1 point for each bolded answer. A score of 5 suggests depression, and a score of 10 or more indicates depression. This next assessment I would like to show you guys is the Generalized Anxiety Disorder 7-item, also known as GAD-7 scale. So like before, you guys can stop the recording so you can take the short assessment, or you can just move on. But for those who answer the questions and want to know their score, scores range from 0 to 21. So if you have a score from 0 to 4, that means there's minimal anxiety. If you score from a 5 to 9, that is mild anxiety. 10 to 14 equals moderate anxiety, and a score of 15 to 21 indicates severe anxiety. So education. So it's important for family to be aware of warning signs of mental illness in older adults, such as memory issues, changes in personal care, social withdrawal, and changes in mood. Social support serves major support functions, including emotional support, for example, like sharing problems or venting your emotions, informational support, like advice or guidance from friends or a doctor, and instrumental support, like providing rides or assisting with housekeeping, stuff of that nature. There's also programs and services for the elderly and for caregivers, such as improving mood, promoting access to collaborative treatment, also known as IMPACT. This is a team-based program that includes psychotherapy for older adults with depression. It is a long-term intervention that lasts several months or up to a year. So we know that caring for someone who has a mental illness isn't always easy, especially for the family. Caregiver role strain is real, so it's important to remind the family or caregiver that there are programs that support and provide resources to them. And then last would be medications. So prescribed medications can provide potential benefits to patients. With prescribing such medication, adherence is important. So the elderly oftentimes forget to take their medication, so it's important to find a plan so that they're able to take their medications correctly. Prescribers should also explain side effects clearly to both the patient and caregiver or family so they are aware of what to expect. On this slide, I decided to put down hotline numbers just in case like anyone does have anxiety or depression or a mental illness and they just need someone to talk to. These numbers aren't just for the elderly, it's for everyone. So, or if you know someone, you can also give them the phone number or whatnot. And these are my resources.